Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about how to have a healing mindset. You see, I've been practicing for over 30 years now, and I've seen over 100,000 patient visits. And I just noticed certain things in those patients that are say not improving or resistant to change or even resistant to get started. And there's certain things you can do if you are suffering from any type of chronic condition, autoimmune disease, chronic pain. There's certain things that you can do to help set you in the right direction for getting better. So I'm going to go over a major one today, and that is focus. What you focus on expands. And just to give you an example, like we'll take Hashimoto's, which is a thyroid autoimmune disorder. So when I had this over 10 years ago, and this is how it goes. So you go see a doctor and they tell you have hypothyroidism. If they check your antibodies, okay, so Hashimoto's, say you're diagnosed with that, like I was, and I go to the endocrinologist, and she says, yeah, this is what it is. You are gonna have to take Synthroid the rest of your life, and there's nothing you can do to fix it. Over time, your thyroid continues to degenerate and wear out, and you'll have to take more and more medication, and you'll typically continue to have more nodules, and they'll get bigger. You may have to have surgery at some point to have your thyroid removed. Your thyroid can go up and down, hyper, hypo, and it can be a real mess. So anyway, if so, say I just let that go. Okay, so I could have taken it in and believed it like a lot of people do, because that's all they're exposed to. And so if that's their belief system, okay, if you take that all in, and then you go online and you're looking it up, and you get involved with all these support groups and communities, and everyone's like commiserating about this and that, and how bad they feel, and this medication, low dose naltrexone, that works, all this stuff, and people, and it becomes your identity. You're a Hashi patient, or you're a rheumatoid patient, or people go around saying they're diabetic or so they start identifying with their illness, and then that becomes their identity. And when that happens, it's not easy to get out of it. So what I did, I didn't take that for an answer. I started researching. This is over 10 years ago now. Seeing what causes autoimmune diseases. How did this happen? It just didn't come out of nowhere. And basically, what I found out is, common cause for most all chronic health conditions: physical, chemical, and mental stress. So, I had symptoms of fatigue, brain fog, aches and pains all over. I had numbness and tingling in my hands, carpal tunnel syndrome, IBS. I was just miserable, adrenal dysfunction, adrenal fatigue. So I started to do a lot of testing on my own, and functional testing, just figuring out, well, for instance, looking at the chemical stress causes. Well, checked food sensitivities, tested for that, and checked for parasites, did digestive, stool tests, checked for parasites, checked for heavy toxins, heavy metals, deficiency. So it turns out I was deficient in various nutrients, like the main ones were B12, magnesium, vitamin D. Turns out I also had yeast overgrowth, parasites. Yeah, I mentioned another video. Went to Rio de Janeiro with my friend for spring break when I was in chiropractic college. Thought we were going down there to pick up some women, and turns out I picked up a parasite instead. I mean, I was pretty miserable, but it lasted for years. I had no idea. This is years later. I had IBS, all these digestive symptoms for years, and that can induce an autoimmune condition like Hashimoto's. Toxins, did some heavy metal testing. I was high in arsenic and mercury. And arsenic, how's that possible? I ate a great healthy diet while I was eating rice multiple times a week because it was, supposed to be so healthy for you. I couldn't have gluten, so I was eating rice this, rice that, rice protein drinks. So anyway, really loaded with arsenic. And then lastly, food sensitivities. After a lot of testing, I was sensitive to many foods, but the main ones were gluten, dairy, eggs, legumes, sugar, yeast, and others. Those were the main significant ones. And so anyway, I started to work on all this and eliminate all these things and replace the deficiencies and detoxify and started to do some physical, I got the right type of physical manual treatment for the aches and pains and numbness and tingling and all the structural issues I had going on, which were a lot. And I started getting better. And but I also had to be open to getting better and not live in that past of every little, just identifying with that condition. And then I had to start focusing on the little improvements along the way. And that's how I was able to get better over time. And then over a couple of years or so, my antibody levels completely went down to normal, and it's been almost 10 years, and I've been clear. My antibody levels, like I said, are normal. I had rheumatoid arthritis antibodies that were elevated at the time, and that went down to normal, and that's been fine for over 10 years also. So, and the diet I came up with in the course of all this that I found helped me the most, and in turn, all this information I learned I use with patients, and I've treated a lot of chronic health conditions, autoimmune as well, and it refined as I go along. So that term I came up for this diet that has been so helpful is the free diet, because it's not only free of gluten, but free of gluten, grains, yeast, sugar, corn, soy, legumes, like all the most common food allergens to allow your body to start heal and reduce inflammation and clear up gut issues. And I'll also put a link for you below if you want to click on that so you can get a free copy of that. And then, just recently, so this is a classic case of what I'm referring to. I had a patient also at Hashimoto's. She was 60 years old. She had, a number of different symptoms: headaches, dizziness, fatigue, brain fog, anxiety, aches and pains, digestive issues, IBS. She was so feeling so awful when she came in. I'd been to so many different doctors, traditional, natural, functional medicine doctors. So she came in, did the evaluation, some testing, put her on the program, the free diet, the natural medicine program was, our 7-step functional and free program, which is designed to determine your underlying root causes and provide long-term permanent solutions. So she starts going through this, and we do regular follow-up visits to see how you're coming along, make sure things are going well, do any updated testing. So I met with her on a follow-up visit, and my assistant Kayla had already updated her notes. We're probably 2 or 3 visits in to this, and she sat there in front of my desk. We were talking. She just seemed as miserable and depressed as the first day she came in, like almost as like nothing was working. So I looked at her the notes that Kayla had done, and there were dozens of symptoms out of maybe the 50 or so she reported that were all better. And many others that were improving, significantly improving. And there were just maybe 4 or 5 that were the same. So about 90% of her symptoms were either all better or significantly better. And I said, well, why are you not happy? Like, why you still seem really down? So she was still focusing on those couple things, those few things that were left, that weren't any better, and then the little bit of the other things that were improving that was still there. But I'm like, well, you're like 80 or 90% better. That's what you need to start focusing on. I mean, you're so used to feeling miserable. You're so used to being in that disease mindset, identifying with these conditions, that you're just not allowing your body to, you're not allowing yourself to feel the improvements and to accept that you're getting better and to kind of reward yourself, because it's a lot of work. It's a lot of work to commit to following a specific diet, to taking all the supplements, to going to bed early, to getting outside, exercise, it's a whole lifestyle program. And you're committing to doing that, so you should pat yourself on the back and appreciate all you've accomplished. I mean, you're the one that's doing it. I'm guiding you. You really got to appreciate yourself and love yourself a bit, and realizing you are getting better. You are getting better. You can get better. You can resolve this, and that's what you need to focus on. So that was, that seemed to go fine. And then the next visit, it was a few weeks later, she came in. She was like a new person. I mean, she was just so happy, doing so much better in all these different areas. And since then, just continuing to improve every time we see her, talk on the phone or through email, just continuing to feel better and better, and all these different things she came up with. So I'm confident on this track now that she is allowing herself, and she can completely get better, because that's what she's identifying with and focusing on, is her new, better, healthy self. And if you have, a chronic health condition and that you're struggling with, and are doing this and that, I mean, that's something that I would give a try. I mean, first of all, get the right treatment. I mean, seek out, if you're open to it, and you're open to seeking out a natural doctor, functional medicine, holistic type physician, if you want to get to the root cause and not just cover up your symptoms with this drug and that procedure and this surgery, if you're the type of person that wants to get to the underlying root cause and be provided with solutions, then I would seek out a physician who can help and guide you in that area. And as you find out specific causes and start to do the treatments, whatever it is, whether you come in here, whether you go to another doctor, health coach, start appreciating and accepting and noticing the little improvements, and focusing on that health health outcome, and see yourself, as that, new, healthy, vibrant individual that you can be. So, thanks for joining me today. I really appreciate it. If you know someone who could use this information, feel free to share it. Subscribe to my YouTube channel. I'd appreciate that. And again, thanks so much for joining me today, and look forward to seeing you next time. Take care.